Chasing the Mind, podcast number 11. Don't Judge a Book by Its Cover with Melisa Frizzi. Welcome to Chasing the Mind, hosted by Dr. Angela Johnson and Dr. Stephanie Schwartz, the podcast that explores the art and science of the mind. Each episode, we will feature a topic or guest who offers a unique perspective in answering the following questions. How do our thoughts influence our sense of who we are? How do we then impact the world around us? And can changing our mind change everything? Today on Chasing the Mind, Dr. Angela and Dr. Stephanie discuss invisible disabilities and universal healthcare. The interview this week is with Melisa Frizzi, who talks about the challenges of living with Marfan Syndrome. And in the final segment, the doctors take on the classic film Gaslight. Spoiler alerts, the movie is 70 years old.
So on today's episode, we have an interview with Melisa Frizzi, who talks to Dr. Stephanie and I about living with a chronic medical condition called Marfan Syndrome.
It's actually pretty rare, and it's important to actually bring awareness to some illnesses that we may not be familiar with.
Yes, and I think one of the things that Dr. Steph and I talked about when we were preparing for this episode is, one, the focus that has kind of nationally been on healthcare, and two, about issues with regard to invisible disabilities and people who suffer with illnesses, either physiological, chronic conditions, or mental health problems that may not be so obvious to the eye, but nonetheless impact the lives of those individuals.
Definitely. And we should preface this by saying that Marfan Syndrome is a physiological disorder. And it was interesting to talk to Melisa about her perception that it's a very visible condition, whereas I think our experience was that it wasn't so obvious that she suffers from a medical condition.
Exactly. And in some respects, I think this distinction that we make between what are physical disabilities and mental disabilities is really an arbitrary and very fungible line. I mean, the fact of the matter is that most mental health disorders are undergirded by some physiological issue, either a genetic predisposition, difficulties in terms of processing certain chemicals in the brain that lead someone to be more anxious and or tend more toward depression. So we kind of have made this arbitrary line.
And the way we talk about mental disorders is very telling. I was talking to a doctor about the fact that in many insurance companies, mental health is referred to as behavioral health. And I actually kind of object to that, because when you talk about having a problem with your leg, you don't discuss it as a problem with your walking behavior.
You have a broken leg. You have a problem with your walking behavior.
But that is how we talk about mental.
Exactly.
You have a problem with your mental behavior, or just with your behavior.
Right.
When you have a brain problem many times. And so calling it behavioral health to try and distance it from perhaps being an innate condition, a medical condition, a physiological condition. It's really, like you said, a very odd and arbitrary line.
And it goes to the issue, I think, that we, as human beings, and we all do this, we all try to distance ourselves from the things that make us uncomfortable. We all try to, in some way, pretend that we have all of this control over what's going to happen to us, whether it's a physical issue or a mental issue. I mean, we eat right, we go to the gym, we get our sleep and all of that because we think somehow we're going to put together the magic 1, 2, 3 that means we're never going to suffer from any kind of physiological disease. And in the same way, we distance ourselves from the fact that all of us are to some degree, some more than others, vulnerable to these kinds of mental conditions that can be incredibly distressful and debilitating.
Absolutely. And this really fits in also to the dialogue that we're currently having in our culture about healthcare in general.
Exactly. The idea that, well, I'm a healthy person. Why should I pay for all the sick people? And in fact, well, you know what? Your house isn't on fire either, and yet your taxes go to pay for the fire department. You're not currently fighting off robbers and bandits in your home, and your tax dollars are going to pay for the police department. And in the same way, the actual definition of insurance is paying for something that you don't necessarily need right this second.
Absolutely true. And even the way we talked about health in this country is very odd. I know one politician not so long ago, in the past few weeks, was talking about how if people get a job like they're supposed to, then they will get good health insurance. And people started, like on Twitter and other social media, like posting a picture of grandparents in a nursing home who have dementia and saying, here's my grandmother, she's 93 and she doesn't know her own name. What job would you suggest get in order to get health insurance?
Yeah, I mean, it's hard because as people who work in the field of mental health, like we said, this idea that if you fall down and break your leg, well, we can x-ray that, we can measure it. There's a prescribed treatment. We put you in a cast, you do physical therapy, and in 12 weeks, guess what? You're better. And there are these struggles and issues that people have that are, again, rooted in the same kinds of physiological problems, but are manifested in depression, anxiety, compulsions, hearing voices. These are not things people picked to have. And yet we somehow put them off in another category and say, well, that's not the same as breaking your leg. That's not the same as giving someone treatment for a catastrophic illness if they get hit by a car or something. And it's exactly the same.
We also make a distinction about those tests, like the x-rays that you were talking about. And people think that those are somehow very scientific, whereas psychological and psychiatric measures are not, that they're sort of a bunch of hooey or people don't believe in them. And in fact, medical tests are often only as good as the people who read them, and often have quite a bit of error rate.
Yeah, I mean, that's something that people don't know at all. I think that people go into their doctor and they think that their doctor's going to be able to tell them anything. And if you have worked in emergency rooms like Dr. Stephanie and I have, you know, doctors are guessing too. Medical doctors are often just doing decision tree kind of things, like, well, if not this, then that kind of decisions.
Right. As I've mentioned a few times, recently was in the hospital with pneumonia, and guess what? They took an x-ray and it came back completely negative for pneumonia. They decided to do a further test because of my symptoms of not being able to breathe. And when they did a CT scan, then there was evidence of pneumonia. But if you were just relying on the x-ray, that x-ray would have been not an accurate measure of anything that was going on with me medically. And x-ray's not particularly a better test because it's physiological. Neither are any of the other measures. Psychological measures are very scientific as well.
Right. And the issue is that most of the time, medical care is guided by symptoms. And in the same way, mental health treatment is about treating symptoms. And those symptoms are rooted in biology. Those symptoms are rooted in the physiology of the individual. They're not that the person is not doing the 5 things they should do to not be a depressed person. And it's so hard because on one hand, we really do advocate and believe in this culture, this ability to improve your outlook and your outcome based on something that you do. And a lot of times there's a lot of things you can do that do make those things better. But for many, many, many people and for many things, there's nothing you're going to be able to do. You're not going to be able to will yourself into not having schizophrenia.
Have you tried not having schizophrenia? Could you just try harder? Could you try a little harder to not have cancer?
Right.
You're not trying harder. This is actually one of the things that I find a little problematic about positive thinking. People, I think having a positive attitude is helpful for some people and can go a long way in getting them to move whatever illness they have in a positive direction or do things that would help. But sometimes when people make really strong statements like, if you have a positive attitude, you can overcome anything, it gets to a point where it starts blaming the people who are ill.
Right.
Because it's like, well, if you were more positive, you would be better by now.
Exactly.
And that's just not borne out by the research. It's not borne out by the research that people who have cancer get sooner faster if they have a positive attitude. It's just...
Right. And it's so hard when it comes to these illnesses that we can't point to on a slide and we can't measure in a blood test. When you're talking about people who struggle with depression and anxiety or compulsions and obsessions or trauma responses, you can't convince someone that if they just had more positive thoughts, they wouldn't have nightmares or startle responses. And it's hard because, again, we fight so hard in our own minds to convince ourselves that we are the captain of our own ship and the captain of our own destiny. And if that were happening to me, I'd be able to deal with it differently because I'm me.
And we should know that different cultures see these things differently. I think there's a particularly American phenomenon of we are the captain of our own ship that pervades a lot of different aspects of our culture. And health is one of them. I mean, it almost gets to the point where people are like, well, if you do X, Y, Z, you won't die. Like, you'll live forever.
Right.
I'm like, people who do X, Y, Z don't die of heart disease or whatever. Well, they die of something.
Right, right.
It's an odd way of thinking.
Yeah. Yeah, I mean, and again, so this ties into the healthcare debate that we have in this country where we sort of make people who don't have access to healthcare, we sort of villainize them and say, well, it's their own fault, that they have all these struggles and problems when we don't provide the things that are absolutely shown to help people. I mean, we know that things like preventative care, being able to get vaccines and access to regular health care prevents people from getting to the point where they need crisis care. And so that's one end of the extreme. And then the other end is that we should all be able to fix everything by our positive thinking and essential oils. I mean, and that's a whole other end of the spectrum that is just as rooted in fallacy. I mean, there's nothing about, like you said, positive thing. I can't wake up every day and think I'm going to be 5'10". I mean, I could think that every day. I could write it on a card and ponder it and put it out into the universe, but I'm still like 5'5". Like, I'm never going to be 5'10".
But have you tried being 5'10"?
In my mind, I am really 5'10". I really am. No, I mean, and then that ties into this other idea of these invisible disabilities with people that struggle with things that we can't always see, but nonetheless are real. They are not a figment of the person's imagination. They are not something that they've made up because they're not being positive enough. These are real struggles that people face, and we can't diminish and minimize that just because it's not immediately apparent to our naked eye.
Right, and that includes mental illnesses, but also includes many physical illnesses as well.
And And I think, that's one thing that Melisa brings really clearly throughout the interview is that while she does do all those things of being positive,
she's actually incredibly fun and positive.
She is. And she does all these creative and interesting things to, be who she is in the world. But there are some things that no matter how positive she is, these are the things she has to deal with. She has to deal with going to the doctor and having certain things checked out all the time because these are the vulnerabilities that come with her particular syndrome. She can't just be positive. It's hard for someone, I think, like us who sees people all the time who are struggling. Not only are they struggling with what they're struggling with, but they're also struggling with the perception that they're just not doing enough.
Right.
And I think that's a horrible thing to add on to anyone, that not only do you have to deal with whatever the situation is, but you also have to deal with the judgment of everyone else thinking you're just not doing enough.
And the third piece is that you're also often dealing with navigating healthcare and health insurance in this country.
Exactly.
Where it's so complicated that people can't understand it and have that burden on them while they're ill.
Right. Right. And I think, as we record this, it's looking like the current repeal of Obamacare that's been proposed by Senator Graham and Senator Cassidy isn't going to go forward based on what's been reported in the news. But you know what? There's going to be something else and something else and something else. Because until we as a culture and as really a community decide that, healthcare is kind of a basic human right. There is a basic right to be able to access the necessary care to live out your life to its fullest.
I've never understood why people will wave the flag and talk about life, liberty, and the pursuit of happiness, and not think that there's any connection between life and healthcare. I'm flummoxed. I mean, it just seems obvious to me.
And I think, Dr. Steph, you've said before, too. I mean, the fantasy about healthcare is that we're not going to need it, but everybody needs it at some point. That's just the bottom line. Everybody needs it at some point because we are all going to face some health crisis in our life. Just everybody. There's just no way around that. And the idea that I don't want to pay for someone who's sick, well, guess what? Someday it's going to be your turn and you'll be the sick person. Anyway, enjoy this interview that we had with Melisa. She was terrific. And again, I can't say enough about what a positive, wonderful, happy, gregarious person she is. And creative person. And you know what? She has struggles just like the rest of us. And thank goodness she is able to be in a state where she does have health care.
So hi, Melisa, welcome.
Thanks for having me.
Tell us, just to start with, what is Marfan Syndrome?
Great question. So Marfan is a genetic disorder that affects the connective tissue. For anybody that doesn't know, connective tissue is what holds all of the body's cells, organs, and tissues together. It plays an important role in how the body develops and grows. So it's really important. In people with Marfan's, the connective tissue is weakened. And so because of that, you'll see, I'm sure we'll talk about it in just a few minutes, but all the different problems that come along with Marfan's is due to the fact that the connective tissue is weakened. And because the connective tissue is all throughout the body, there are lots of different systems throughout the body that are affected.
Can you tell us a little bit about when you were diagnosed and what that was like for you?
Sure. So I was technically diagnosed around 1991. I was 11 years old, so I was still young. And it came about because my mother was watching me walk, and I was kind of tilted to the side, and she would always yell at me, stand up straight, stand up straight. And I thought I was, but, I didn't know what else to do. I tried to straighten myself out, but it just was never working. And so my parents took me to the doctor, and there's where they found out that I had the Marfan's because I had scoliosis. I had a curvature of the spine. And so they noticed that. And what I should tell you is that when I was about 3 years old, I went to the doctor because my father noticed that I was sitting very close to the television. And they kept moving me back, and I would always move closer and closer to the television. And so my dad kept moving me back, and they kind of figured, something's wrong here. So they took me to the doctor at that time as well. I ended up getting glasses. I have dislocated lenses, but they didn't know at the time that was Marfan. They kind of put it together once they saw the scoliosis happening. They kind of put it together, and right after that, they noticed a heart condition that I have. It's mitral valve prolapse and an enlarged aorta. So kind of all came at the same time, but I was technically diagnosed at 11. And
what was it like for you to be diagnosed at 11? I know for everyone, especially for girls, that preteen age is a challenging age no matter what. So what was it like for you to be going through that and being diagnosed around that same time?
It was difficult. I didn't have a normal childhood. Most kids were out, they were playing, they were going out with their friends, going to the movies, and I was stuck going to the doctor every couple of months. I had a major surgery. I had a spinal fusion done to correct the scoliosis, which meant I had to have 2 metal rods placed in my back, and so I was out of school for a long time at that time as well. I had to get homeschooled by one of my teachers who thankfully came and was able to come and teach me at home so I didn't fall behind. And I just remember that I missed out on so many things. I know it sounds silly maybe, but I missed out on field trips. I missed out on just going to dances and things like that. And it was I don't know, I felt sad about it, but at the same time, it was nice to see how many people rallied around me. I always got visitors, to come visit me, especially after the surgery. Everybody would come over, so it kind of made me feel special too. I knew I was unique, but it didn't seem to affect me in terms of, making friends or anything like that. So that was good.
It sounds like you've had a lot of supportive people around you throughout everything.
Oh, yeah.
But how do you feel that having a chronic illness like this, especially diagnosed as a child, maybe changed your personality or who you were, who you might have been, how it affected you growing up like that to the person that you ultimately became?
Right. I think that having this chronic illness made me more empathetic to people, for sure. I look at people now differently. I'm not quick to judge how just because somebody looks like they're okay, I don't just assume that they are okay. I know that there might be something underlying. So if they say they're not feeling well, I'm always sensitive to that. I feel like I missed out on a few things, but I don't feel like I'm still the same person that I would have been, but I think I'm a lot more open about who I am because I want people to understand that chronic illness it's tough to deal with on a daily basis. And I don't want people to dismiss people that do have a chronic illness and kind of just forget about them. And I want people to know that these people that suffer from chronic illness need help, need support. So I always am trying to just let people know and be honest with people and open with people so that I can live my life. I don't know if that makes sense. I want people to know what's going on with me so they don't have to feel like they're walking around on eggshells around me. And I don't want to feel like I'm burdening them. So I try to be open and keep the lines of communication open with people.
So how often and how do you tell people that you have Marfan Syndrome?
It never really comes up. Nobody ever says, nobody asks the questions. They may notice something and they might stare. If I can, I will take the opportunity to say to them, a lot of people, I know people out there can't see, but I have a lot of stretch marks on my shoulders. People will oftentimes, they'll say to me, did you lose weight, or did you lose a lot of weight recently? And they'll remark on that. And I take that opportunity and say, no, it's actually not from weight loss or weight gain. I have something called Marfan Syndrome, and I go ahead and explain it to them. And usually they're really grateful to find out about it. So I take any opportunity I can. If I notice that somebody is staring or is interested, I'll try and take that opportunity just to educate somebody.
Well, maybe that's a good opportunity for you to talk a little bit about what might be the more visual or obvious signs of someone who has Marfan syndrome.
Sure. The biggest thing with people that have Marfan is you're going to notice that they're really tall, really slender. I didn't get that aspect of it, unfortunately. I wish I had, but I am pretty tall, especially when compared to my family. I'm only 5'8", but people with Marfan will go to 6 feet, 7 feet. They're really tall, really slender. Like I said, they have long features, so long limbs, long fingers. They're probably usually wearing glasses because many of them have dislocated lenses, so you probably would notice that. Let's see, what else? Curvature of the spine, like I mentioned before, so you might notice that they're maybe slouching or they're tilted to the side. They have sometimes they'll have crowded teeth because they have a higher palate in their mouth. Their chest, their breastbone will either stick out or will go inward. So you might notice that mine goes outward. Let's see. They've got flat feet oftentimes. Their joints are really flexible, so you might notice that. That's most of them. And like I said, the stretch marks already, you'll notice those. And the stretch marks are important because it's not due to weight loss or weight gain. You'll see that they are, somebody's really tall and slender. You don't expect to see stretch marks. So that's kind of a telling sign.
It's interesting. You've mentioned quite a few times people staring. And I'm actually going to put Dr. Angela on the spot today because she just met you today. I've actually known you for a while. But Dr. Angela, would you have noticed anything unusual, or would you have had cause to stare at Melisa?
No, I don't think so. But I think having you point out, you do have stretch marks on your shoulders. You are very tall. You have very long, thin fingers. But I don't know that I would assume that it was because of an underlying syndrome necessarily. And I think that's maybe getting at the issue of like people may be curious about, the way someone looks, but they may not put together that, this is part of an actual syndrome that someone has. And as you mentioned, there's external things, but there's a lot of internal issues going on too that people wouldn't be able to see, that are all coming together. So that makes it, I think, maybe twice as challenging.
Mm-hmm. Absolutely. People don't know the other things that are going on inside. They can see all of those external things that I mentioned. But, there's a lot going on inside. The heart is one of the major things that Marfan affects. The two things that most people will probably have if they have Marfan is aortic enlargement. The aorta is the main blood vessel that carries blood out to the rest of the body. It's an important part of your heart. And when it becomes enlarged, there's concern for tearing of the aorta, and people can suffer from aortic dissection. That's not something you want to happen to you. Obviously, it's not very good. And it's important to diagnose Marfan's early on because of that. Because if you let it go, it could be fatal. So, it's those other things that are happening inside your body, you've got to be careful. So those sometimes when, be on the lookout for those external signs, because a lot of people that have Marfan don't even know it. Because like you said.
Well, yeah, I read that. I read somewhere where it said that half the people who have it may not be aware.
Right, because those signs, like you said, maybe they're not obvious to you, but I know what to look for, and I do. I look for it all the time, because I wonder if that person has Marfan. It's so silly sometimes, but you know what? That's why I want to get this out in the open, because it's so scary to me to think that somebody who doesn't know they have it, and this whole time they're suffering from an enlarged aorta, all of a sudden maybe they bend down too quickly, or maybe they are doing some kind of strenuous activity that they shouldn't be, and all of a sudden their aorta tears. They don't know what's going on, and if it doesn't get treated right away, it is fatal.
Yeah.
It's scary.
And I think that's one of the reasons we wanted to talk to you today about Marfan syndrome. There's a lot of language in our society about awareness, and people talk about things like breast cancer awareness or autism awareness, and whenever people use that phrasing, I often think, who is there out there who is not aware of breast cancer or autism, who has any connection to the media or general popular culture? Those are things that very, very few people are not aware of. Certainly there may be a need for funding, but not necessarily awareness, whereas opposed to Marfan syndrome, where there's very, very little awareness.
Right. You're right. There's not a lot out there on Marfan, I feel like, though I will say that I do feel like they're trying really hard to get this information out there. I follow the Marfan Foundation on Facebook. It's a great way to just kind of poke your head in, see what's going on. Learn a little bit about it. Marfan.org is a great place to go to find out about, just get any facts, just so that you know a little bit about it. I appreciate, I think I mentioned this to you the other day, how a lot of times when I go to the doctor and they ask you to fill out the form before you go in for the visit, I always put down I've got Marfan, even though they probably know, but I always put it down. They always, if I get a new doctor, they're always questioning, they're always wondering, and they're always interested. And they always ask me without fail, do you mind if I have a student a fellow or somebody, that's in here, and they're here today. Do you mind if they come in and sit with us for the visit? Because it's so rare that they see somebody with Marfan. So some people might find that annoying, but I love it. Any opportunity that I get to have somebody come in and check me out and just see what it's all about, I love it, because they're learning, we're learning. It's great. New treatments could come from it. It's wonderful.
So say a little bit about that. You mentioned some of the more serious side effects or potential issues you might face if you have Marfan syndrome. How much control do you have over avoiding those issues, and how much time and energy do you have to put into managing this syndrome so that you don't face some of those serious consequences?
That's a daily. It's daily, because you need to, especially for the heart, I'm on medication. You've got to make sure that you take it. It's really important. I mentioned that I have mitral valve prolapse. The mitral valve is a valve in the heart that, in people with Marfan, the valve is floppy. They say it's floppy. The valve is meant to be a one-way exit for blood. With a valve that's floppy, the valve closes when it should be open and forces the blood backwards. You don't want that happening. So I'm on something called a beta blocker, which slows the heart rate down, slows your blood pressure, and it will help with the flow of blood in the right direction. So that's why I'm on that. And so I take that daily. I hate missing it. I feel terrible when I do miss it. I don't have to go to the doctor daily, but several times a year to deal with different issues. So for instance, I have a cardiologist. Obviously, I visit him without fail every year. And, every time I visit, I go and get some testing, echocardiograms, electrocardiograms, ultrasounds of the heart. Basically, I've had to have some MRIs done, CAT scans, things with contrast, without contrast. So it's a lot of poking and prodding. But that's just one doctor that I see. I also see an ophthalmologist for my eyes. I have a contact lens specialist. I recently had to get a retina specialist because they saw some thinning in my retina. Let's see, who else do I have? I had an orthopedist for a long time that took care of the spinal fusion that I had. Oh boy, I think I have a few others. But yeah, I mean, it's a lot of work to go to all these doctors, make all these appointments, keep the appointments. They're all in Boston, so it is a lot of traveling. You do need to make sure, though, that you keep up with it so that you, like you said, hopefully I can avoid an instance like or a situation like the aortic dissection.
What does it mean to you that your health is such a sort of constant presence in your life?
It's frustrating. It can be frustrating. I have my dark moments where I'm like, why me? Poor me. Couldn't it be somebody else? But then I start thinking about, there are people in this world that have much worse problems. And I kind of pull myself out because even though it does take a lot of effort and I do get tired, I feel fatigued, I think it's important to just understand that it's just the hand I was dealt. You move on. You find the solution and you work with it. And that's it. You got to keep going. Thankfully, I've always say that I'm so thankful to live where I live. We have the best doctors here. There's no doubt about it. Children's Hospital in Boston, you'll hear me sing their praises all the time because I still see them even today. Even though I'm 37 years old, I still go to Children's. They still see me there. So I love them. They're the best doctors. And, I'm just, like I said, I'm grateful that they're constantly researching and trying to find treatments and have preventative measures that you can take if you diagnose it early enough. So I do get frustrated. I do get fatigued. That's really what my life is on a daily basis. But I try to manage it in different ways as best I can.
Well, in one of the conversations that we had prior to being on the air today is that you mentioned, so for people who have Marfan, often there's a parent or a family member that have the syndrome, and then it's 50% heritable. If a parent has it, there's a 50% chance the child will have it. But in your case, that isn't what happened.
No, nobody in my family has it. Again, that was one of those moments where I was like, why me? But,
Explain what that is
Yeah.
when someone doesn't have it in the family.
Absolutely, sure. Because no one in my family had it, and I did not inherit this from a parent, they call that a spontaneous mutation because it just kind of poofed out of nowhere. It just happened. I always get nervous about considering if I'm ever going to have children, will I pass that along to my children? It's always been a concern for me. If my parents couldn't help it, it just happened with me. It is what it is.
You mentioned having children. You are married. Did having Marfan syndrome affect how you went about finding a romantic partner?
Good question. No, I don't think it affected me in finding a romantic partner, but we, with my husband, I did have to let him know what was going on with me. He was eventually, back when I was younger, I wasn't quite as fatigued, but I'm getting there, and who knows what the future is going to bring. If I'm already tired and I'm only 37, a couple of years from now, what might happen, or if I need to have another surgery, or if my heart worsens, or whatever the case may be. I did need to let him know that. I did need to let him know what was going on with my body. He knew something was up because, of course, he saw the stretch marks as well. And, of course, the breastbone situation where it's sticking out, he saw a couple of things too. So, I obviously needed to discuss with him what my issue was. And, I have a great partner who is accepting, of the condition that I have, tries to help me whenever he can. That's what's important, is finding somebody who loves you no matter what and that can be there to support you.
How about telling your friends? How do you do that, or when do you do that?
I have maybe a unique situation. I think a lot of my friends have chronic illness, and so it's been very easy. I've been very fortunate, I have to say. in my life to just have such a great support system. Not only in my family, but also my friends. And because they have all these chronic illnesses, we all just kind of discuss it. I've never felt embarrassed or ashamed to tell them. They're wonderful. They've offered to take me to doctor's appointments. When we're out in the snow and I'm nervous about falling due to the spinal fusion that I had, I'm always nervous when I go out into the snow. And slipping and falling, they always extend their hand out to hold my hand. They know if I'm getting tired that I'm going to need to take a break, and they're always asking, "Are you all right? Do you need anything?" So I'm grateful to have that kind of open relationship with them.
And I think when we were talking about this earlier too, and you were mentioning some of the struggles that some of your friends have that you labeled as being chronic illnesses. And I think they fall under a category that's become a little bit more present different forms of media, invisible disabilities. And perhaps you feel that you fall under that as well. As we said, nobody necessarily looking at you across the mall who didn't know you might not assume that you had any issues going on necessarily. But there are a lot of disabling features of this syndrome that are challenging. And this idea of people who have invisible disability and what that means for them, trying to negotiate with work, relationships, the healthcare system, the society that we live in, all of those struggles. Do you think about that at all?
Oh, of course. I mean, you can't get away from it. People are quick to judge. They don't, like you said, maybe they don't understand why I need to take a break, or they may think I'm just being lazy or something. But it's not. I need to take breaks because of the condition that I have. I have a pretty sedentary job where I'm sitting all the time and I'm looking at the computer screen a lot. I had to be straightforward with my boss when I first got the job. I knew what it entailed, but I knew that I wasn't going to be able to sit for hours on end and be staring at a screen. I told them what my condition was so that I could work in some breaks when I needed to, or if I needed to adjust the font on my computer or get better lighting for something, things like that. I have to make it work. Otherwise I would be in a position where maybe I couldn't work, so that I don't have to live my life kind of just sitting at home doing nothing and feeling, defeated. I don't want to talk too much about healthcare because it's different for everybody. But I do remember when I was younger trying to apply for disability, and at the time, I don't know if anything has changed, but they don't consider Marfans to be that big of a deal, I guess, because they just kind of said, no, it's not, it's not severe enough. Which I found to be shocking. For the amount of times that I go to the doctor a year, I know it's only once a year, but it's so many doctors and so many things to handle. Surgeries. I've had several surgeries. Obviously, the one on my back was the biggest. I've had some foot surgeries, all the medical testing. So I was shocked to just hear them deny like anything that I was asking for. I do have to think of that on a daily basis because, like I said, I don't know what the future holds either.
Well, this is a disorder or a syndrome that can get worse as you get older too. So it's not necessarily something that's stable, right? It can be progressive.
Oh, right. Absolutely. It can certainly worsen over time.
One of the things, if a person is in the position of having a white-collar job that perhaps has some flexibility, that offers time off, you don't necessarily take into account what other situations are. There are many jobs out there where if you have to take a lot of time off for doctor's appointments, if you have to take time off for surgery, you lose your job, period. And for those of us who are lucky enough not to be in those kinds of jobs, sometimes that reality doesn't click in. We don't realize what a struggle it can be.
I don't doubt that that's an issue for some people. I mean, my case of Marfan is probably mild compared to a lot of other people that have it. I can't imagine what those people go through, because there are still other things. It's, like I said, it mainly affects the eyes, the heart, and the bones and joints. But there are other things that it can affect too. It can affect your lungs. It's just anywhere there's connective tissue in the body, it can affect. So, people who have a more severe case, and do have to go to the doctor more often, or do have to get more surgeries, and do have to get more testing, I can't imagine what it's like. So it's something that you need to be aware of all the time and kind of be on the lookout for.
It was interesting. Dr. Angela and I talked about the fact that having a chronic illness in some ways is sort of like having an extra pet to take care of that's absolutely no fun and completely unpleasant.
That is true.
It's like, a thing you have to take care of. Not that pets are things. We love them as beings, but, something you have to take care of, constantly maintain, but you're not getting any pleasure out of it whatsoever.
No, definitely not. It's not something I would wish on anybody. As I get older, I notice that it's just more, I am more fatigued. I don't know how else to even explain it. It is, I just get tired easier. I have trouble. I just went to DC this past weekend, and getting through the airport was a struggle. I'm sure that's a struggle for anybody, but for somebody like me, I taking the shoes off to get through airport security and everything. By the time I was done with that, I didn't have any energy left that day to go do any sightseeing once I arrived in DC. I was just tired from just the getting through the trip portion of it, So I noticed that is becoming more difficult as I get older.
And yet you maintain a really positive attitude. And that's what I've been struck with throughout our talking to you. And I come back to that image of you at the very beginning when you were 3 and you kept sitting too close to the television and your parents kept moving you back and then you kept creeping forward. And then they took you to the eye doctor. Instead of seeing it as purely a behavioral problem, wow, Melissa's being a bad girl. We tell her to sit back and she keeps creeping forward. They said, maybe there's a problem here. Mm-hmm. And I think that really speaks to the support of people in your life and maybe what's helped you develop this positive attitude.
Absolutely. I think for anybody with I don't want to speak for everybody, but I think anybody with a chronic illness, you need support. And no matter how much I always try to deny it. I feel like it's a weakness or something, but I always try to just, pretend I don't need any help. But, and I did that for a long time. But at some point, I needed to say to myself, I do have this issue. I need to accept this help or my life's going to be miserable. And by doing that, I feel kind of a release. I'm not hiding anything. I, let people know when I do need help. They're willing to help, so I take it. And that does give me a positive attitude because what else could I ask for? I've been dealt this hand. I have to deal with it. My life is going to go on. So having these people around me, I don't want to drag them down either because then where will I be? So I try to keep that positive attitude, like you said. And, everybody around me is it's a bit of dark humor that my friends and I have, but, I have difficulty walking. I'll just give you an example. I have a little bit of difficulty walking, and I had a friend, unfortunately, she passed away recently, but she was in a wheelchair, and she knew that I had trouble walking as well. And we always laughed, and we said we should start a gang, and we'll be the Crips, short for cripples. And I know it's dark humor. I'm sorry. I don't want to offend anybody out there, but it was just something that we bonded over it, and it was just something that we could smile over. And, the just other little silly things that, for instance, during one of my foot surgeries, I remember my sister got me a little gift before the surgery, and it was Dr. Seuss's foot book. It's just silly little things that make me laugh and make me smile. And just because I do have this condition, it doesn't have to bring me down, doesn't have to weigh me down. There are people that will pick me up.
Well, then it doesn't define everything about you.
Right.
And on that note, I'm going to, I may regret this, but I'm going to open up the floor to a discussion of nail art, because I do know that one of the ways that you and Dr. Stephanie have bonded is over a very creative pursuit of nail art. And that's part of one of your outlets, right? One of the ways that you treat yourself. And Dr. Stephanie has explained to me that it's very meditative. So I'll let you two go.
Ooh, goody. It's probably not the best. Probably not the best activity for me to do, because it does require a lot of sitting and a lot of detail work. But I've found ways around that too, because I do like to do nail art. And I use magnifying lamps and magnifying mirrors to kind of make things a bit easier for me. And of course, I'm probably not as quick with the nail art as Dr. Stephanie is, but
I'm actually relatively new to the field of nail art, so there is no quickness. But it was interesting when we were talking about doing this interview on Marfan Syndrome, and you told me that you use a magnifying glass, and that's one ways that you will adapt in your daily life. And I had no idea. I thought you just produced lovely nail art.
Thank you.
When did you become involved in when did that become a thing that you were very interested in?
I don't know. I think I just saw it a couple of years ago. So I saw something on YouTube, I'm sure. Mm-hmm. And I was like, oh, that's so pretty. I wish I could do that. And I actually would bite my nails all the time. I'm always stressed out. So, I said, oh, geez, I wish I could do that. I wish I could do that. And I said, I wonder if I start doing this, my nails will look too pretty and I'll stop biting my nails maybe. So I decided to give it a try. And, I'm progressing, let's just say that.
2 years later, wow, that's actually impressive. Perhaps we will post a picture of nail art on the Chasing the Mind website, but there's a lot of techniques, particularly stamping of patterns onto your nails, that I've found very impressive, Melissa.
Oh, thank you. I'm trying. That is... Oh boy, sometimes it's easy, sometimes it's not so easy. You just keep at it, gotta keep going. I want to try and, explore some new techniques. I love nail art. It's just, like you said, it's a creative outlet. It's just a way to kind of let go, and where I can't be quite as active as I'd like to be. It kind of gives me an opportunity to kind of express myself in other ways. So that's why I like it so much.
Yeah, I mean, it can be meditative and absorbing.
Absolutely.
It's like coloring. It's what I said. I told Dr. Stephanie, I said, it's like coloring. It's like, that was the big thing the last couple of years, is this meditative coloring that adults are doing, because it's something that focuses your mind in a way that's not ruminating on all the things we normally think about all the time. But also allows us to just find a place of just being present with what we're doing in the moment. And I think that that's part of what nail art does for many people.
I mean, I kind of agree. I don't know if Dr. Stephanie feels the same way, but I know that I do my nail art pretty late at night. And it's because it's quiet. It's quiet. I have a chance to reflect on day's activities. I have time to think about what my plan is for the next day. It kind of releases the tension in my muscles, just to know that I can just sit and, focus on something that I want to be doing, and that didn't take up all my energy during the day.
Yeah, and you certainly can't do anything else while you're doing that.
That's right. No.
Because if you touch something else, then you're starting over from scratch.
Right, exactly.
So tell us a little bit about some famous people with Marfan.
Oh, yeah. So one of the main people is Abraham Lincoln, was thought to have Marfan, and obviously he was very tall, had those long limbs and the slender frame, the long features. His face was very long, his fingers were very long. So Abraham Lincoln, he was, I wonder what would have happened to him. I don't know if he had any heart problems or anything, but obviously he was shot before, anybody probably could find out.
And there's actually, I think, been some back and forth about whether he actually had it. It's definitely been a theory over the years, but there's been some give and take.
Yeah, I mean, I haven't researched it too much, but I have heard that as well. I thought I read somewhere that people in his family had Marfan as well. So maybe he did, but like I said, it's tough to find out, I guess.
I think there was some question of whether his sons had it as well. So,
well, yeah, I mean, he could have passed it on, I suppose. So,
but it was interesting is when I went to, because I didn't know anything about Marfan syndrome really, except for maybe Abraham Lincoln had it. Is that there are a number of disorders that are very similar to Marfan that affect connective tissue in different ways. They have different names, but there are a number of these kinds of syndromes.
I think you had mentioned some other people that had it.
Yeah.
Was there a sports star?
There is Isaiah Austin, and he was, I guess he was diagnosed a few years ago, and he actually had to stop his career from what I understand, but because of the Marfan, he had a heart condition, and there was always that concern of the aortic dissection, like I mentioned earlier. But I guess he's been cleared since, and I guess he is now playing. So, I mean, he's a good example of how, Marfan affects people differently. In his case, obviously he's well enough to play sports again, and that's great. I'm happy for him. He's been great in trying to bring out awareness for Marfan as well. I think Jonathan Larson, who
from Rent.
Yes. Yeah. I think his
he actually passed away, I think, from heart problems before it opened.
Right. I think he had an aortic dissection, actually. I don't think he was diagnosed with Marfan, but I think everybody questions whether or not he had it, and it's rumored that he did have it, but I don't think it was ever diagnosed.
One of the reasons I became interested in Marfan syndrome, in addition to having a testing client many years ago who had it, but I was interested in Julia Child. I think she's just a fascinating person in many ways. But I was wondering if she had it because she was so tall and sort of lanky. And in my research, I found out that no, in fact, she didn't. She actually had sort of appearance similar to someone who might, but she just came from a tall family and was just sort of tall, lanky, and at some points slightly awkward, but did not have it.
What I read was that 1 in 5,000 people may have Marfan syndrome, but only half the people may actually know. So it seems to be, while it's a rare disorder, underdiagnosed. It seems that that's something that people aren't aware of.
Right. That's why I'm grateful that you guys asked me to be here today and talk a little bit about it, because if it goes undiagnosed, it can be fatal. And if, all it takes is a parent looking at their child who's just walking and maybe standing a little crooked, take them into the doctor, take them into an orthopedic specialist just to take a look. Because if other underlying factors are there, like the heart problems or the eye situation or something like that, you could potentially save a life. It's just takes a little bit of looking out for each other.
Well, on that note, it has been so enjoyable having you here today, and particularly in addition to bringing us information about Marfan Syndrome and what it's like to have it, bringing your positive attitude and telling us about your ways of coping has just been lovely, and we've enjoyed having you here.
Yes, definitely. And if we do an entire segment on nail art, you are certainly going to be the first person we invite.
Absolutely. And Melissa, I know you and I are going to continue in our campaign to convert Dr. Angela to the field of nail art.
Except her nails would have to grow beyond little stubs, so that would be the first thing. So, but
hashtag
again,
goals.
Yeah, thank you, Melissa, for coming. We really, really appreciated having you here.
Thanks so much again for having me.
So we are doing Diagnosis Movie this week, where we talk about the psychological issues that are relevant in a particular movie. And today we will be talking about the classic movie Gaslight.
Yes, and just for those of you who suggested this movie, I'm one of those people that has to do the thing in order. Like I can't see the third season of anything if I haven't seen the first two seasons. So when someone suggested Gaslight, I researched it and found out that it was actually a play in the late 30s.
So then you time traveled to the 30s.
I couldn't do that. I would have. I swear to God, I would have. But there was a 1940s film that was made of Gaslight, and then the 1944 film, which is the one that was referenced in The Request, which is with Ingrid Bergman and Charles Boyer. So I actually watched both films back to back because I'm just that dedicated.
Podcasting dedication, folks. There are quite a few psychological themes, to the point that the term gaslight has become something that's in current vogue, where people talk about being gaslighted by people in their lives. Yeah.
Yes. And I mean, the film actually, it's sort of interesting because you can sort of diagnose it from two directions. I mean, the obvious point of view is the apparent losing of the mind of the woman. Either in the first film, it was Bella. In the second film with Ingrid Bergman, it was Paula. But that she is losing her mind in some way. So there's the obvious, what diagnosis would she have for whatever mental illness that she has? And then there's the obvious diagnosis of the husband who is inflicting this game on his wife to make her think she's losing her mind. And what would we diagnose him with?
And basically, is he psychopathic or sociopathic?
Exactly.
So we talked a little bit about the idea that there are some very odd psychological symptoms going on with the wife.
Yeah, no, that's one of the things I thought was really interesting, was that the way she was losing her mind was apparently moving pictures around and losing brooches, you know, sort of losing objects or taking objects and putting them in places where she didn't know where they were, but he knew where they were, kind of thing. And I'm like, what exactly mental illness does she have? Like kleptomania? Like, except she wasn't stealing things from the bakery shop. She's like snatching her own items and hiding them, which is kind of an odd onset for mental illness. It culminates a bit with her, quote unquote, hearing things and seeing things, because she sees, and this is what the term comes from, she sees the gas lights dim in her room, which indicates in houses that were lit by gas, that meant that there was a light on, or someone else was in the house who lit some other pilot light, which would cause the lights in another room to dim. So by seeing the lights dim, she's imagining there's someone else in the house who's dimming the lights or lighting the lights. And then she was also hearing people, you know, overhead making all sorts of noises. That's a little more in keeping with an actual psychiatric diagnosis.
Well, certainly at the time in the 30s and 40s, definitely was still in the heyday of psychodynamic theory.
Correct.
And one of the most popular that's in quotes, diagnoses for women would have been hysteria.
Right. Which could have been anything from you are not being a good wife, you're a gossip.
You're being unreasonable.
Right.
I don't like something that you're doing. You are being a suffragette.
Right.
That certainly, fighting for women's rights is certainly, to some people, was an indication of mental illness.
Or having any sort of like actual sexual interest, I suppose, was also deemed as being a mental illness for women.
There's a social media post that runs around every once in a while that shows a list of things that were symptoms. And it included things like reading novels.
Right. Basically, anytime you were a pain in the ass, if you were a woman.
Or not doing what the man who was controlling your life told you to be doing.
You could be
called
right.
hysterical.
And that is the threat throughout the entire film in both versions of the story, is that the husband is going to get doctors who are going to come and certify that the wife is insane and she's going to go off to an asylum where she's going to die a raving lunatic. And it's sort of laughable now to some degree to watch a film that is the culminating threat. But the fact of the matter is that there were women who were dragged off to asylums and who were locked behind, locked doors, and that's where they remained.
Yeah, it was a very different time. Certainly now, I feel like as therapists, sometimes we're begging insurance companies to give it. Like, could you give me 5 days? This patient is psychotic and they really need care. Could you give us 5 days in the hospital? In those days, you could be put away for years.
Exactly. That's certainly part of the diagnosis of gaslight would be, okay, what diagnosis does the woman have? And in fact, we find out in the film that really there's nothing going on with her. Although it's interesting in both versions of the film, the female character is struggling even within herself because she's both kind of assured of her own sanity that she hasn't done these things, but she's also very vulnerable to the influence of this man telling her that she really has. And so there's this struggle. Both actresses in both films portray this kind of intelligence and strength in the wife, but this vulnerability of completely falling apart because they're being told that they're losing their mind.
I think you've really hit on something interesting here. That's why I think this term has kept a resonance up until today, where people talk about feeling gaslit or gaslighted by their family members, and where people are trying to convince them that what they know to be reality is not true. Because I think this is something that happens to many people to this day, often but not exclusively women, where loved ones in your life can really try to dominate you and try and convince you that you're nuts.
Right, but I think it's also in the public culture. And I think one of the reasons I wanted to do Gaslight is that there was this whole thing that came up in the last week about, and this has happened a million times in the last couple of years, where we have seen women come forward with stories of bad acts by men who are powerful, who have more money, who are, have more influence. And they've made statements about the misuse or the abuse that these men have inflicted on them. And the immediate assumption is that they don't remember right. They don't know what they're talking about. And that it's really up to them to prove beyond a reasonable doubt that what they're saying has any merit. And the assumption of credibility is automatically handed to the man. And this came up a week ago with, James Woods tweeted something obnoxious about a film involving a 24-year-old male and a 17-year-old male. And Amber Tamberlin, who's an actress, tweeted back, "Excuse me, but when I was 16, you tried to take me to Las Vegas and you were in your 60s. And he immediately said, "That's not true. You're a liar." And the whole social media internet cycle starts picking sides. And the assumption's always with him that he is telling the truth and she has to prove it. And so, Amber Tamberlin, tweeted conversation she had with the other girl that was there at the time. She wrote an article for Vogue. She wrote an op-ed for the New York Times. And her point was that it's never he said, she said. It's he said, and she doesn't get a side because she has to prove it. Like, she's always under the assumption that she's a lunatic.
Right.
That she's got something to prove. She's got some axe to grind.
It's similar to the Cosby case where, she's criticizing, she being any of the women who were accusing him, she's criticizing him and accusing him. She must be after his money because he has money and he has power. And it took, even with Cosby, it took so many women. It wasn't when it was he said, she said, the assumption went with him.
It took like 30 women.
It took like 30 women
coming forward. Oh, maybe.
But the first few, why is she just bringing it up now?
Exactly.
Why do you think she's just bringing it up now?
This is why it's so interesting that this kind of film that seems so dated to look at now, and yet, you know what? It's the same thing. It's the same thing now. There's the little woman and the big powerful man who's pulling all the strings, and the assumption is that he's the one who actually has the real story. And so it was funny when I was thinking about okay, so how do we diagnose the husband in this film? Do we say he's a sociopath? Do we say he's a psychopath? I don't know. Or do we just say he's just like everybody else? He's a jerk. But he's like a lot of entitled men. Yes, he's sociopathic in that he manipulates his way into this relationship to achieve a particular end. But
in this case, it was financial.
Yes. To find jewels. But on the other hand, what he's doing so brilliantly is he's playing the cultural hand he's been given in a way that is very shrewd and very smart. He knows he has the advantage because of the fact that he is a man and she is a woman. So yes, he's a sociopath, but part of the reason he's successful for as much of the film as he is because he kind of knows the landscape.
Right. And it's interesting that he starts to make his wife literally doubt the evidence in front of her eyes.
Exactly.
She is seeing lights dim. She's seeing the gas lights dim. And he's saying, you're crazy. Other people, what are they saying?
Right. And she has a letter in her hand. He's saying there was no letter. And it's and even in both films, the thing that kind of annoyed me the most, and unfortunately it is true to some degree, it's this outside male that comes in and says, aha, I knew all along this is what was going on, and don't worry, Mrs. Poor little sociopathic wife person. I have solved it all and I will take care of you. Run off to your room and lock the door and I will take care of everything. And I'm like,
So there's still no agency.
The only point there's agency, and this is interesting in both films, is that once the story has been shown that he is a liar, that she is not crazy, in both instances, he is subdued and tied up. And in both instances, the wife then becomes the tormentor. And in one small way does take back agency by using the lies that he used against her, against him, by threatening him. And in some small way, I suppose, that's satisfying. It's unfortunate that it comes at the end of all of this to do. And there's just a small little nugget of, oh, you're the one who's weak now. And now I will use my madness as a way to torment you. And if you've seen the film, then you understand what I'm saying.
Huh.
Although honestly, the film came out in 1944. If you haven't seen it by now, spoilers are kind of like, hello.
I don't know. People get really mad about that.
It's been like 70 years, but I was going to see it this weekend.
It does actually remind me of, in some ways, a reversal or a difference from Gone Girl.
Oh, yeah.
Where the husband is...
The one being gaslighted, yeah. Yeah.
Oh, spoiler alert. Spoiler alert. That was, yeah.
But I think that was what was so awesome about that book, was that on one hand, I was reading it and I kind of knew what was going on because I'm one of those people that can figure out the twist really early and it's annoying. But on the other hand, it was kind of like, you know what? You had this coming. Like, I was kind of okay with it. And maybe that's because of the gender differential. I mean, if it had been the reverse, I probably wouldn't have been, but...
Well, and the end was so different in that one. Okay, spoiler alert. If you have not
read Gone Girl.
Perhaps fast forward a bit on our podcast here. But they basically end up, if I recall correctly, they end up
together
in a completely loveless marriage.
Is it loveless, though? I don't know that it is. I think in the end, he has to hand her the respect that she was due all along.
Yeah, but they really don't seem to like each other very much by the end. It seemed like, the sense I got was that there was like, from his perspective, this romance and wonderful stuff at the beginning, and at the end they're just kind of like, yeah, you're still here.
Except that at the beginning, she had been the thing that he wanted.
Yeah.
And that's the whole other issue is, the women who try to change and be the thing that they want, and then they cheat on you anyway. And, you cheated on the wrong girl this time.
Yeah.
Mr. Affleck. Anyway, this was fun. So I think we need to have another suggestion. So tweet us at Chasing the Mind, #DiagnosisMovie, or comment on Chasing the Mind Facebook page. And as always, you can put questions or comments on our website at chasingthemind.com.
Thank you for listening to Chasing the Mind. Today's episode featured music from purpleplanet.com. Please visit our website at chasingthemind.com to sign up for our newsletter, to hear about upcoming special events. And please subscribe on iTunes or Stitcher.